Jennifer, I believe you're on.
Jennifer Butlin, Executive Director of the Commission on Collegiate Nursing Education, facilitating Group 4. And the breakout session focused on improving efficiencies of accreditation through greater collaboration among stakeholders. We had a very collaborative group discussion. And the first charge for our group breakout was to identify who are the stakeholders of accreditation. Wasn't that complicated, actually, and there was consensus among these among the group that the public is involved, practitioners, faculty, the various certification bodies. So we've got certifiers, other people in the credentialing world, licensing boards, state boards, other regulatory bodies, all involved there as credentialing organizations. We also identified federal agencies that may be making decisions about hiring, for example, and only hiring the VA, for example, graduates of accredited programs, and the U.S. Department of Education and CHIA, which are groups that offer recognition of accrediting bodies, were identified as stakeholders. Students, of course, parents, families of students. Someone identified the parents as the people who often pay for the bill, the tuition bill. So they were included in terms of students and their families. Employers and employees, patients, clients, consumers. And I'll just say a word about this. Originally, the public and consumers were lumped together as a single stakeholder group, and we had some interesting dialogue that really they're different. And we used an example in veterinary medicine, which is that the public may be the family who doesn't want their child to get rabies. They may or may not be pet owners. But the consumer of veterinary medicine might be the pet owner who gets their dog updated on shots so they won't give rabies to any other child in the neighborhood. So it was just used as an example in terms of the public and the greater common good for the public versus consumers in accreditation. Also, accrediting agencies, both institutional and specialized agencies, both in the U.S. and outside the U.S., communities in general as stakeholders, institutional and program staff, program officials at colleges and universities were all identified as examples of stakeholders, and finally, professional or membership organizations or associations. So that's a pretty exhaustive list. You may think of other stakeholders not mentioned here. This was our best groupthink at the time. Next, we identified benefits with regard to achieving greater collaboration among stakeholders. And here are the benefits. Cost savings, efficiencies through economies of scale, developing a common understanding of what each entity or what group does, adding meaning to processes. If one group is requiring a certain type of report and another group requires a different sort of report, why is what they require different? And is there meaning behind that, or is it just because it's always been done that way? So might there be a conversation in terms of streamlining reports and benefits to add meaning to why are we collecting this, why are we sharing these data, and are they meaningful? Streamlining processes. Some of the groups talked about providing data in real time to their constituents. We also talked about benefits in terms of reduction in report redundancy, different agencies collaborating so as to only require one annual report, for example. Building common understanding and holding each other accountable. We talked about the benefits when practitioners are involved in the accreditation site visits along with educators. The benefits of public consumers being involved with accrediting bodies. So developing that common understanding helps hold us accountable so we don't do as much navel gazing, the Academy making decisions about, education quality in isolation of the other important parties. Sharing evidence of improved effectiveness, identifying and learning from best practices, and that was within a profession, across professions, national and international. Transparency and the benefits of more transparency when key stakeholder groups are coordinating efforts and working in partnership with one another. Another benefit identified was mobility of students practicing across borders when international partners are identified and can be working collaboratively. Two agencies talked about their agreements and coordination with the US accreditor and then the Canadian counterpart accreditor, and working together to either make decisions or being involved on visits, reviewing each other's standards, and so on. And the benefits to students who may be crossing borders. So they may have been prepared in a certain profession in Canada, but they want to practice in the US or vice versa, and that there might be some reciprocity or recognition across country lines. Another benefit to achieving greater collaboration was learning from peers in the international community. And improved performance of educational program and accreditors. Some of the accreditors mentioned the benefits of, asking the question, what can we as accreditors do better to serve our communities of interest? And many of the accreditors have those surveys and post-visit assessments and things like that in place to ask that question to improve performance. And finally, gaining knowledge from each other, which I think is not separate and distinct from some of these others, but was worth mentioning in terms of taking the time to have conversations, having conference calls or face-to-face meetings with the invested parties. And so that was discussed. Challenges was the next topic discussed. Challenges to achieving greater collaboration among stakeholders. And one big one was issues related to turf, either an unwillingness or lack of know-how to collaborate, to give up a position of authority, to give up money, to give up power, lack of willingness to give a little and to take a little or to negotiate were identified as challenges. Logistically incompatible systems. Something may look great, like the willingness and desire to engage in IPE, but when you look at the challenges with regard to scheduling in an academic health center, that is viewed as a challenge and possibly a barrier, not because of lack of desire or interest. Lack of flexibility, different purposes, missions, and visions. We talked about this for a while because it's not to say that each entity's mission isn't good and admirable, but an accrediting agency's mission is slightly different from the state regulatory body's mission, which is slightly different than the credentialing or certification organization's mission, and so on. So it's not that one is good or bad, it just becomes a challenge when you talk about how can we collaborate, because we may want different types of information. Competition among different groups, competition for clinical sites, competition for students to enroll in your programs. Those were all identified. Competition among accrediting agencies when there's more than one that exists in a profession. Another challenge was accreditors' roles and responsibilities that seem to keep expanding when pressures are put on the accreditors to do more. If only the accreditors would require this, and that would solve all of our problems. And then a year later, why are the accreditors being prescriptive and telling us to require this? So it's some of that that's at play was identified as a challenge. The fact that trying to collaborate may actually create more work, and who has time for that? And the investment in time and energy. And we talked about needing to make that upfront investment to see the long-term benefits. And it may take extra time, may cost some money, but the hope is that over the long term, there would be cost savings and more efficient processes when accreditation collaboration is achieved. Identifying key players to be at the table was identified as a challenge. It doesn't always happen. Sometimes all the key players aren't at the table, or key players are at the table, but they don't necessarily have the authority to make decisions. Myth busting was discussed in terms of, are we clearly communicating our roles, our missions, our values, what types of decisions we can make. And finally, lack of understanding about roles and missions was identified as a challenge. In terms of opportunities for collaboration in the future, we didn't really get to the with whom piece as much as we did just the opportunities in general. Dissemination of effective models. If we don't need to reinvent the wheel, if we can learn from another profession and if we see what best practices are. Taking advantage of opportunities when leadership changes over time. If you tried something 10 years ago and it didn't work, try again. Maybe leadership changes, maybe missions evolve in organizations. So don't give up, but to try again under new leadership to see if you can make some headway to collaborate and become more efficient through collaboration. Research opportunities and identifying not only best practices, but evidence-based practices to make improvements and to collaborate further. Learning from international colleagues and colleagues in other professions, not working in silos. And finally, opportunities to conduct more joint site visits and have collaborative agreements with each other and with international partners. And I gave the example of the US and Canada and a couple agencies that were collaborating in that way. What needs to be in place in order to prepare stakeholders for accreditation, collaboration, readiness? After we got through how abstract the question was and whether the group wanted to answer it, we did come up with a few ideas.
Just for the sake of time, because we're going to run out
Yeah.
soon. What were the takeaways from that?
The need for there to be common understanding, and if multiple stakeholders are going to be involved, that they need to be oriented to what we're doing, why we're doing it, and have a common understanding. And I would say that that was the major takeaway in terms of preparing people to collaborate. And finally, the group asked that I do two things in this debrief. One is to point out that an issue came up and it hasn't been resolved, but they wanted me to raise the question for the group just to think about it, not to be answered today. And it's this notion of whose responsibility is needs assessment. There was some debate because we identified consumers and the public as being stakeholder groups. Yet there was some debate over whose responsibility is it if there are many programs in a particular state or region of the country, whose place is it to say we don't need any more programs operating here? Or conversely, to say, we need more practitioners or providers in this part of the country, and there was some debate over whether that was the accreditor's responsibility. Is it the state's responsibility? Are there antitrust issues involved? Yes. But there are some accreditors who put a moratorium on programs or say we're not accepting applications for a period of time, and others who don't. So it was this issue of supply and demand. Whose responsibility is it, and how does this resolve itself? And finally, the group asked that I share in a few slides here the results of a survey that was done earlier this week of the members of the Association of Specialized and Professional Accreditors, ASPA. And so my agency, CCNE, this is not a tool or findings of the National Academies, I want to be clear. CCNE did a brief informal survey of the ASPA member accreditors in preparation for the breakout session. And I was asked by the group to share these results briefly so you could get a taste of what's happening in accreditation. There were 31 specialized accreditors who responded in the past 72 hours, which is impressive. You can see from the list that many are in the health professions, and there are accreditors from outside of the health professions. And the first question, there are only 6 questions, who do you consider to be the stakeholders of accreditation? And look at the overlap here between what the accreditors self-identified as stakeholders and what our group today identified as the stakeholders. A great amount of overlap, plus our group identified some that weren't on here, like the federal government, professional associations, and so on. The second question is, does the accrediting agency engage in any notable collaborations, agreements, or memorandum of agreements or understanding with other organizations that may increase efficiencies in accreditation? And you can see here the numbers of accreditors who reported having such collaborations or agreements with either state agencies, accrediting agencies in the U.S., accrediting agencies outside the U.S., or with professional membership or associations, which was the most common answer here. The third question was, in the past 10 years, has your accrediting agency made any improvements or changes to reduce costs for institutions' programs under review? Over 80% of the accreditors responded that they had, and they gave up to 3 specific examples of how they had done that in the survey results, which I will not be sharing at this time. Question 4 is, in the past 10 years, has your accrediting agency made any improvements or changes to streamline processes and or save time? So the earlier question was to reduce costs, and this question is to save time. Or streamline processes, and you can see about 84% responded yes, they have done this at their accrediting agencies. And second to last, does your accrediting agency conduct collaborative or joint site visits with other entities? And you can see about 60% of the accreditors are engaged in joint reviews or joint site visits with other entities. Many of these were accrediting agencies, some were state agencies, licensing bodies, and other types of organizations. And with what types of entities? You can see that many are with state agencies, regulatory bodies, accrediting agencies, and then there were some, many educational institutions do internal peer review types of activities, and that was identified as an other, that we do joint visits when an institution does their own internal review and gets on that same review schedule, which helps with logistics and streamlining processes. And finally, in the past 10 years, approximately how many joint site visits has your accrediting agency conducted with other entities? And you can see that 44% responded none, 37% said 1 to 9, 4% identified 10 to 25 joint site visits, 0 agencies reported the purple category, 26 to 50, and 15% of the respondent accrediting bodies reported more than 50 joint or collaborative visits over the past 10 years. And that concludes my presentation.
Thank you. All right, you've left us with something to think about tonight. I believe we're at time, which is the look I was getting. But just before we go, Eric and I would like to thank you for being so engaged today and participating in our discussions, and we found it very fruitful. Have a good evening, and we'll see you in the morning.